So as the state of healthcare facilities continues to make headlines for all of the wrong reasons, Nomantu Nkomo-Ralehoko has taken over the reins as Gauteng Health MEC. She now takes over as some hospitals battle water and staff shortages and ailing infrastructure, not to mention widespread corruption allegations. There's also load shedding and growing calls to exempt healthcare facilities from power cuts. MEC Nkomo-Ralehoko joins us this morning to outline how she plans to deal with these challenges. Good morning, MEC. It's great to have you with us.
Good morning. Good morning to you too.
Wow, what an incredibly big job you have as Gauteng Health MEC. Are you up for it?
Yes, I am up for it. I think it's a big job indeed, but I think we have to make sure that some of us do take those responsibilities in dealing with those big jobs, which is the health system in our country that is having some problems, in our province in particular. But I don't think it's the other problems that we can't deal with them. As you have indicated earlier on, that there are quite a number of things that are happening, but we need to put systems in place. We must have backup systems again if there is a problem. For example, the issue of load shedding that is there now. We do have some backup generators that are always there on standby, so that if there's anything happens, they kicks in immediately. But it's unlike those things will not be there. But somebody must take full responsibility. And I think I'm one of those now that must be responsible to change the systems that are not correct, as you are saying.
Well, we've had a number of health MECs in Gauteng over the years. We've had several health disasters over the years. And experts will perhaps say that we've not come any way in solving some of the challenges. Corruption is one of them. Life Esidimeni comes to mind as well when we think of the challenges in Gauteng Health. But let me not outline the challenges. What are the biggest challenges as you see them, MEC?
The biggest challenge that I've noticed now already is the issue of our infrastructure that is ailing in our hospitals. And we have a plan now that we've put in place. On Saturday when I started, it was my first day at work, there was a strategic plan. And those issues of infrastructure are part of our priorities. We are going to sort them out. We will definitely need to, because we have said to the team, identify areas, hospitals and clinics where there is an emergency that we need to deal with. So they've done that, and then we will definitely start going in those hospitals and assist where we can. The other challenge that we have, if you remember, it was the issue of long queues in our hospitals and in our clinics. On Saturday, no, it was on Sunday when I was at Para, and I made it a point that I go there because I want to check in all these hospitals. After your interview, I'm going to Western too, just to specifically check what is it that we should do. If there are long queues, how can we make sure that our waiting areas are cleared? But we're going to automate almost everything in our hospitals. We want to change everything so that we can be able, all those records that you see when you're at the reception there, it's easier for us. We need to have a database of all the patients that we're having in the hospitals. But once we do this automation of our systems, things will keep going to get better. The other issue is this one of us not paying service providers on time. The 30 days payment that government wants us to do. Already I've told the team finance that they must clear everything there. They must give me a report that talks to each and every service provider that is supposed to be paid. How much are we supposed to pay, so that we can start categorizing those processes. And because we want to close the issue of not paying service providers on time. We want to close the issue of accruals that is there. So those are the things that I needed that report, and I've given them 7 days to work on that because the reports are there. They're going to work alone. They're going to work with the Department of Finance because there is a war room that was formed by Premier Makura to ensure that we clear that backlog on the payments of service providers, because that's another critical thing that we should be doing. Another thing is to encourage patients so that when you go to a hospital it's an environment that you want to be. Because if you go to a clinic, other people are supposed to go to their clinics, but they will say, I'd rather go to a hospital than to a clinic because I will not going to be assisted. So which means we need to change our attitude as clinicians that are there. When you see a person that is not well, make sure that you attend that person properly. You make a person comfortable so that he can come back again. So hence I'm visiting now all the institutions, the health, and we want to change that, including the attitude, because we must work on our attitude. And now there's an additional part in our system, in our department, which is health and wellness. That's another focus now that we're going to do. Wellness was there, by the way, but we never strengthened that area. Now we're going to strengthen it. We're going to have civic education that will do to citizens, talk about the importance of health, the do's and don'ts if we are not well, start telling people about exercising, because again, other diseases, we can overcome them without going to hospital, without eating pills, but if you do exercises, you drink a lot of water. So those are the programs that now we're going to do, telling the society how we can change our system and release the overburden to our institutions, by the way, because once not everybody goes to the clinic or hospital, we're releasing the burden of the healthcare system because we are overburdened by some of the problems that we're having.
I'm very surprised, MEC, that corruption wasn't at the top of the list of the concerns that you have coming into this discussion today.
No, it is. I was still trying to clarify you this one. I was going to go back to that one. Remember, it was the last part of your question when you were rising now. Corruption is part of my list. Once we get the reports, because there are reports that we're supposed to get from forensic, from SIU, and I've asked the team to give me the files about those reports. Some, they are still pending. Once I get that, I'm going to look into those and have plans on how can we deal with that, because part of the things that we should do is consequence management. When a report goes out, check what is this person has done, what needs to be done, why did you do this? So those are the things that we must do and deal with you after that. Because definitely there must be consequence after what you have done in terms of corruption that is being raised. But SIU is busy, forensic reports are busy with some of the incidents. I know you want to talk about Tembisa. The SIU is busy with that process in Tembisa. Once we get the report, we'll definitely, the Premier's office will give us a report so that I'm able to act in those. But those are the things that are part of the priority on the things that I'll be doing.
I want to talk about Tembisa, yes, but I would hope you would want to talk about Tembisa. Some incredibly worrying allegations being made by someone who was in charge of running Tembisa Hospital. Several line items just under that 500,000 mark. And we know why it's under the 500,000 mark, right? Because then it doesn't have to follow the normal processes insofar as procurement services are concerned. I mean, Gauteng Health spends millions of rand investigating, as you say, investigating corruption. It doesn't get any of that money, as far as I know, and you'll correct me if I'm wrong here, it doesn't get back any of the money that's lost to corruption. Hundreds of millions of rand.
Once SIU investigates, remember their role is to get back the money. So we will get back the money, definitely, but we will act on our side, even if we get back the money. Because it's not about getting the money only, but it's about acting on the wrong that a person has done. But again, we're tightening controls now. There is an acting CFO. They have a plan on how we're tightening those controls, not only in Tembisa, even in other institutions. Because it can happen in Tembisa, then it will go to another institution. So there are those controls that we're tightening up now.
Do we have to wait for the SIU report in a context where I am CEO of a hospital and I am very clearly flouting procurement protocols? I'm getting involved with procurement where I shouldn't even be doing that. Is it necessary in a context like that to wait for an SIU report?
You have to, because if you act unlawfully, so you will be in a serious problem. Get the facts. Is this the right person that did that? What happened? Then you can act after the report that has come out. So you can't just act. You have to wait for the report to come out.
Should a CEO be involved in procurement processes?
No, I don't think so too, because there's a finance unit that must be responsible for that. As a CEO, you have the overall coordination of running the institution.
Right.
So you're not only running the SCM alone, but there's no need for you to go there. You must get the report to the people that are employed. So he must tell us if he was involved, but I don't want to get into details in the case because I still need to get clarity of what has happened, even myself. I just get an executive summary, but we agreed that because we are still waiting for this SIU report, then that's when I'll go into details with what happened. So I will appeal that let's not go into details because maybe I will be now jeopardizing the processes by talking to you.
I mean, there are concerns around whistleblowers as well, but I think, you know, that's been ventilated. The Premier has also talked about protection for whistleblowers and so on. But I want to get to the issue of oncology in Gauteng as well. The Breast Health Foundation and Professor Carol Ann Den, this is a senior cancer specialist at Helen Joseph Hospital. They've now left the hospital. Are you aware of this departure?
I am not aware because it's the third day that I'm there in that department. I have not got any report, but I'll find out from HOT what was the problem if they are no longer there.
Yeah. Thousands of people on the waiting list for life-saving cancer treatment in Gauteng. I mean, another issue that I'm not sure you're aware of, that cancer patients are apparently no longer able to receive breast cancer treatment either. Is this something you're aware of? I
am not aware of. I will make a follow-up. I'm happy that you are raising it so that we can make a follow-up and try to correct it if it's like that, because I'm one person that when we talk about cancer, I become very emotional because my husband died of cancer. And I think it should be our priority. And I always say to colleagues, there are diseases that are dangerous, that are killer diseases, that we must talk about them. And the wellness and civic education part that we're going to strengthen, it's going to do that. We will not wait for October month to talk about cancer. Yeah. It must be something that we talk about daily, because it's one thing that sometimes it's hereditary. You can sit here, your child has cancer because of the family background. So those are the things that we must encourage people to go and check. But the institutions of health themselves must have measures to make sure that we don't have this issue of the lines that are there, people that are leaving. Yeah. We need more professionals that must assist us in that area. Well, Professor Carol Ann Ben, who I mentioned to you, who's now left Helen Joseph Hospital, has specialist cancer treatment of 70 years. Is she someone that you would be willing to meet with to try and gauge the extent of this challenge? I will definitely do that, because I'm meeting with all the stakeholders. I will need even the professor that you're talking about, including other professors, to advise us, because we need people that must advise us in these areas where we are working as government. That's why we always say government must have an ear to listen to everyone. If there is a problem, it's the responsibility of government to bring in those people who have those specialists to assist. New Gauteng Health MEC Nomantu Nkomo-Ralehoko, it just goes to show just how big the challenges in Gauteng Health are, because we haven't even scratched the surface in our conversation here today. But let me thank you for your time.